So let's start with number 10. So most of our patients are actually women, and there are lots of reasons for this. And certainly in our dry eye clinics, we do see a lot of women. We know from the Beaver Dam Eye Study that dry eye is twice as common in women as it is in men. And if you break it down by age group, especially our older women, it's much, much more common, as you see here. When we look at Medicare patients, the bulk of them are women, and certainly women live much longer than men. And so a lot of our patients really are women, especially those that present for eye care. They're much more likely to be women. And so much of our day is spent dealing with these female patients. And so whether we're a male practitioner or a female practitioner, these patients are coming to into our offices on a daily basis. So, you know, Marguerite recently presented some information on this, and I'll turn this over to Marguerite to explain a little bit of what she's found.
Thanks. We published in the recent January issue of the Ocular Surface a paper about the international economic burden of dry eye disease. And if you look at US society alone, the indirect costs are over $55 billion. If you look at the direct costs in the US healthcare system, it's $3.84 billion. And it's really interesting. The annual direct costs of dry eye disease are pretty comparable among the areas that we studied, basically US, Asia, and Europe. And it's very significant. So, and if you get a chance to read the article, which I hope you all will, it talks about absenteeism, presenteeism, where people are at work and they're just not functioning up to full capacity because they can't see, because they're struggling with their vision. So as you see here, it's hundreds of dollars per patient per year with dry eye. And of course, many of the severe ones are spending much more than that, thousands per year.
It's just such a huge industry, and now that we have even more options for patients, I think even more money is being invested in these patients. I'm sure you all also see the bulk of your patients being women as well.
Not only that the bulk of these patients are women, but it absolutely impacts their daily lives. It impacts their ability to read. It impacts their productivity, like you said, Marguerite. So this is a real disease. It is not just a nuisance. So I'm so happy that finally this disease is getting its time on the stage, so to speak. Because for years it was viewed as a nuisance. So now it is real. People are paying attention.
Very good. So, and Marguerite's done some very interesting studies on hormonal changes with aging, and I think a lot of what we see is due to this.
Absolutely. You know, men, of course, start off with far more testosterone than women, but women do have some from the adrenal gland, and both sexes are losing testosterone as time goes by. But women's testosterone levels usually fall below the critical amount you need to have a healthy lacrimal gland, and men usually don't ever reach that level. So that's one thing. Another thing is people often ask about hormone replacement therapy, HRT. If you look at the world's literature in English, about half the papers say HRT helps dry eye, and the other half say they don't. It actually makes it worse. But if you look at the Women's Health Initiative, which was published about 13 years ago, but it was a beautiful study, and they followed 27,000 women for a decade. And they came up with the conclusion that HRT actually makes dry eye a little bit worse.
Makes it worse.
Yeah. But the jury is still out for sure, you know.
And because of this testosterone level issue that Marguerite just talked about, I do off-label prescribe testosterone eye drops, which are formulated by a pharmacy in Connecticut, and do prescribe it for my female patients, as well as my male patients. But because we have more female patients suffering from this, more of my female patients do get this prescription. They use it 2 to 4 times a day, and it is very helpful. But it is off-label, and it is compounded.
Yeah, I think hormone supplementation has been something that's really been debated because of some of the risks associated with hormone supplementation. So when I discuss that with patients, a lot of times I'll refer them back to their gynecologist to take part in that discussion with them to talk about some of the risks of cancer that can be associated with that and kind of weigh out, you know, some of the risks versus benefits with those things. But the drops certainly don't have any of those side effects, so it might be worth
because it's topical.
Yeah, so that really avoids some of those systemic side effects they can experience.
And usually by the time they get testosterone eye drops, they've had plugs. So there's really virtually no systemic absorption,
Yeah.
even of the drops.
That's terrific.
That's right.